Salam sejahtera and a good day. This video is on the research focus itself. Before we can look at research focus, let's look at the entire research process. In order to have research focus, we typically need to have general ideas of what research is all about. This will then allow us to establish a research focus. That means allowing us to identify the subject matter to be investigated, determining the objective of the research, and of course, identifying the factors and measurable variables that contribute to our proposed research. This will then allow us to characterize variables, determine sample size, formulate hypotheses before going on for data collection. Upon collecting enough data, this will actually allow us to perform a data analysis and interpretation before concluding everything in a write-up. So what is research focus? Research focus is actually the problem to be investigated. So the characteristics of a good research problem, among others, are a problem that can be investigated through the collection and analysis of data. That means the research itself, the problem itself, is actually researchable. And this problem should have theoretical and practical significance. And it is in fact a root cause of most or all other problems. If you do not identify this, that means the weightage of the problems or the significant research will be minuscule or maybe meaningless. And most important of all, the research focus or the research problems at hand should be a good problem for you. So components of a well-stated research problem should be something, of course, be of interest to researcher and community, containing some parameters that are identifiable with specific relationship that can be identified among the variables. And most important of all these subjects have clear attributes that enable them to be classified and factors to be identified clearly. So from research focus, then we'll have a research hypothesis. What is research hypothesis? Research hypothesis is a tentative explanation for certain behaviors, phenomena, or events that have occurred or will occur. It states the researcher's expectations concerning the relationship between the variables in the research problem. It is a very specific statement and refinement of the research problem. Remember, from research problem itself, you get research focus. And therefore, it allows the researcher to postulate on the outcome of the study. More importantly, since it must be researchable, so data can be collected to support or to disprove this particular research hypothesis. Having said that, since it is supposed to be researchable and clearly defined, you will need to review related literature for all this to happen. And a good hypothesis is actually stated clearly and concise, and to minimize all ambiguity, and whereby in these circumstances, all relationships are known. The relationships that are not known are typically known as confounding factors. Contrary to research hypothesis, you can also have, in addition to research hypothesis, you can also have a statistical hypothesis. So since we know that research hypothesis is actually a statement, statistical hypothesis, on the other hand, is typically expressed as equation comprising of H null and H alternative. For example, in this case, if let's say we talk about a research hypothesis saying that an extended periods of time spent at Mamak store will result in poorer semester results, in terms of statistical hypothesis, this can be expressed in terms of the equation depicted here on your screen. How the problem statement, objectives, and hypotheses are related to each other is actually best described by this diagram. So the problem statement will be actually something that you want to solve, and the objectives itself will be the solution to the problem that you propose to solve. Hypothesis, on the other hand, will be how the solution might turn out. And of course, all this will have different importance from people to people and from organization to organization. This is actually where we need to put in justification, or how important is a problem. Something that could be important to you may not be important to other people, depending on the context of how you look at that research problem. So it becomes important for us to formulate a proper research hypothesis. So in order to formulate a research hypothesis, we need to start from research focus or the research question that you have to post, initially. And based on that, generate operational definitions for all variables and formulate the research hypothesis, keeping in mind that the expected relationship or differences, and it may have other, and it must have operational definitions. This can all be derived based on either inductive hypothesis or deductive hypothesis. Inductive hypothesis is actually based on generalization, and this generalization in turn is based on observation. For example, if we know that by giving certain kind of antibiotics, it will actually help to clear up fever, we can actually design a trial whereby an animal is given an antibiotic and another group of animals was not given antibiotic to prove that antibiotics generally contributed to reduction of fever. Deductive hypothesis, on the other hand, is actually derived from theory itself. You may want to theorize something based on your prior observation, and this theorization will actually help you to formulate and frame research hypotheses and the relevant statistical hypothesis. On the other hand, depending on what you are doing, the hypothesis can also be directional or non-directional. Directional means that this hypothesis will have a defined direction of change. For example, you can say that after treatment with antibiotics, the fever will always be reduced, or the body temperature will always be reduced. And since you mentioned about body temperature always being reduced after treatment with antibiotics, you are talking about one directional change. That means reduction in terms of body temperature. However, if you are not sure how will the research outcome be, then it is best to put in non-directional hypothesis. Non-directional meaning that the changes could be, in this case, increase in temperature or decrease in temperature. So in this case, sometimes hypothesis can also be stated as part of the research hypothesis and statistical hypothesis as earlier exemplified. And in this case, the statistical hypothesis, as earlier mentioned, can be stated as H null, H, and then whereas the alternative hypothesis can be stated as H alternative or H1. Looking at a simple example of research hypothesis, suppose that we look at this. Suppose we hypothesize that horses receiving anticolic drug will have less abdominal pain compared to those who don't. So the research hypothesis will be horses treated with anticolics will have lesser abdominal pain than untreated horses at the end of the experiment. So the operational variables will then be the pain and symptom scores assessed at fixed interval throughout the trial. Of course, another ethical questions that you may have to ask yourself will be, is it ethical to leave some of the animals untreated? Statistical hypothesis, on the other hand, as been explained earlier, will require all these parameters, these qualities to be expressed in terms of equation headed by either H null or H1 or H alternative as depicted on the text. As mentioned earlier, a statistical hypothesis is an assumption about a population parameter, whereas research hypothesis hypothesize what will actually happen. It's just that statistical hypothesis tells us in quantity what will actually happen. So when we talk about null hypothesis, which is typically denoted by H null, is usually this hypothesis that sample observations results purely from chance. On the contrary, alternative hypothesis means that the observations are influenced by some non-random cause. That means there is actually a deliberate factor playing its role, thereby altering the outcome or results. Then it becomes important for us to construct and then test a research hypothesis to see whether our research yielded what we wanted or against what we initially postulated. So hypothesis testing becomes something that is very, very important and must be done robustly so that we can arrive at the right conclusions of our research question. And hypothesis testing comprises of 4 important steps. Namely, the first one, you need to state the hypothesis. So if in this case, you have to state the null and alternative hypothesis. The hypotheses are stated in such a way that they are mutually exclusive, meaning that if H null is true, then H alternative must be false. The next step will be to formulate an analytical plan. And this analytical plan describes how to use the sample data to evaluate the null hypothesis. how to arrange the data, how analysis is to be conducted. And this will require us to understand the amount of factors involved, the treatments involved, and how they are being arrayed, and of course, how to use the necessary techniques and softwares to analyze the results. The third step will be, of course, to analyze the sample data using the techniques available. So what you are doing here is actually to find the value of test statistics that will allow you to say whether the results are statistically significant or not statistically significant, which is actually in step 4, interpretation of results. So this can be done by the application of decision rule, as what we're going to discuss later in the subsequent slides. If let's say the test statistics is actually not significant, then we have to reject the null hypothesis. On the other hand, if it's actually statistically significant, then you have to reject the null hypothesis. So it becomes important for us to know what will be the limit for us to accept the null hypothesis and reject the null hypothesis. Acceptance of the null hypothesis typically means that, well, in this case, it typically means that the results are non-significant, whereas statistically significant results typically resulted in rejection of the null hypothesis and adoption of the alternative hypothesis itself. How do we test it? We test all this by determining that probability that it is supported by facts. And all this can only be done if, let's say, the data is clean, or that means it's not influenced by any confounders or any other erroneous factors that results in false data or false data entry. Let's look at the decision rules on when to accept the null hypothesis, reject the null hypothesis, and so on and so forth. There are two methods that allow us to accept or reject the hypothesis. You can either use the p-value method or the regional acceptance method. The p-value method very much depends on how you define the significance level. Recall that the significance level, as being explained in earlier lectures, is actually the inverse of the confidence level. So if your confidence level, you have a 95% confidence level, then the significance level should be 5% or p.05. In very simple terms, we can say that if the p-value is less than significance level, then we can reject the null hypothesis. An example would be like this. If let's say we set our statistical test at 95% confidence level, that means the significance level will be 0.05. And we will reject the null hypothesis if the tested p-value is less than 0.05. However, if the tested p-value is more than 0.05, for example, 0.06, then we will accept the null hypothesis, saying that all the observations happen by chance, and hence there are no deliberate factors in causing the change in the experiment. The regional acceptance methods depends on the understanding of the regional acceptance and regions of rejection. If the test statistics falls within the region of rejection, then the null hypothesis will be rejected. So in either case, we can simply say that the hypothesis has been rejected at alpha level of significance. Bear in mind that alpha can take a value of 0.01, 0.05 as what has been defined by the researchers themselves. Example will be something that is being depicted here. What is the possibility that patient does not have diabetes when his or her blood glucose level is 1 millimolar, 5 millimolar, 6.1 millimolar, and 10.1 millimolar? If we go by the p-value method, we have to do a single sample t-test and calculate the z-score for each of these values versus the known range of mean. For example, we assume the range of 0.5 to 6 as normal. Then we'll be testing value of 1, 5, 6.1, and 10.1 against that range of 0.5 to 6, which is supposedly a euglycemic value for an individual. So obviously, the value of 1 and 5 will fall within a normal range, within the accepted range, and therefore will be classified as euglycemic. Whereas 10.1 will easily be able to be classified as hyperglycemic. The only issue is with 6.1, which lies at the border. And this is actually where regional acceptance becomes important. because we are going to compare directly the value of this 6.1 versus the known range that has been constructed for this comparison. So in this sense, you can say that the regional acceptance method relying on confidence interval will provide more detail, and especially so since they are very valuable for medical applications. In medical applications, instead of just saying a value is significantly different, we need to know whether the values mean something or not. For example, if you could be reading a PCV value of an animal, and it's not enough for us to say just saying that whether the PCV value is significantly different from normal or not. We need to know how far it is from normal for us to decide whether we need to institute a blood transfusion or maybe other medical follow-ups. If we just rely on significance or non-significance, no follow-up decisions can be made. And therefore, it is common in medical sector for us to adopt a regional acceptance method based on 95% confidence interval. And this research hypothesis can also be tested either as one-tail test or two-tail test. You go for one-tail test if you know that the direction of change. This is actually related to the directionness of a hypothesis. If let's say you always anticipate that the value will be either always lower or always higher than the initial value, then it is safe for us to use a one-tail test. However, if you are uncertain that the outcome will either be higher or lower than the baseline value, then it is best that for us to adopt a two-tailed test, which is actually a much more robust comparison. Another issue that relates to a decision error will be the typical worry that we have about interpretation of results outcome. We could be in a situation whereby we conclude that a treatment has an effect when the treatment is not effective. Or conversely, we could be concluding that a treatment has no effect when the treatment itself is effective. In the former case, whereby we conclude that a treatment has an effect when the treatment is not effective, it is known as a type 1 error. And type 1 error is intricately linked to the alpha, or the level of confidence level. Whereas the danger of concluding that a treatment has no effect when it is actually effective, it is related to beta. In this case, there's a special quantity that can be constructed out of it known as power, which is 1 minus beta. Power will actually allow us to scrutinize how powerful one particular statistical test is at determining whether there is the significant results or non-significant results. Or, in layman's term, how powerful it is at translating observational changes into something that is meaningful statistically.